Welcome to this ANNTalk on nursing research. During this talk, I will focus on nursing research and its importance on patient care. My name is Stephanie Abbu, DNP, RN, CNML, and I am the Clinical Business Coordinator for Neonatal Services at the Monroe Carroll Jr. Children's Hospital at Vanderbilt in Nashville, Tennessee. I am a contributing editor for the Academy News in ANN's nursing journal, Neonatal Network. And like you, I'm a nurse who wants to improve patient outcomes. The World Health Organization has designated 2020 as the Year of the Nurse and Midwife in honor of the 200th birth anniversary of Florence Nightingale. I would argue this year and her remembrance is not complete without a discussion about nursing research. She was a nurse researcher. She was inquisitive, a critical thinker, who measured illness and infection rates among wounded soldiers. Nightingale used careful observation, record keeping, and statistical analysis to validate her work. She used those results to petition the British government to improve conditions for the soldiers, and ultimately she was able to advocate for improvements for public health in all of England. Research helps nurses determine effective best practices and improve patient care. Because new information is always coming to light, it is crucial that all nurses know the importance of research. The findings from peer-reviewed studies can correct old beliefs and pave the way for new treatment protocols, all of which improve patient outcomes. Think about safe sleep practices and sudden infant death syndrome. How routinely babies were put to sleep on their tummies, and now we educate babies are safest when they sleep on their backs. This change is due to research and has saved lives. Research also helps nurses respond to changes in the healthcare environment, patient populations, and government regulations. As researchers make discoveries, the practice of nursing continues to evolve. Every nurse can benefit from knowing why nursing research is important, how research is conducted, and how research transforms patient care. Research used in evidence-based practice can be quantitative, qualitative, or both. Quantitative research, numbers, percentages, and variables are used to communicate results. Qualitative research, findings take the form of thoughts, perceptions, and experiences. While no particular type of research is necessarily better than the other, each type has certain uses and limitations. It is essential for nurses to know the different types of research and how to use them. Evidence-based practice is the conscientious use of current best practice to make decisions about patient care. It's a problem-solving approach to clinical practice based on three things: systematic search for and appraisal of most relevant evidence to answer questions, clinical expertise, and patient preference. Evidence-based practice is so important to decrease variation. Variation in practice leads to variable quality care and outcomes, the potential for errors that may cause harm, higher cost of care from unanticipated outcomes, and increased length of stay. I realize that the financial impact is what is most often thought of when referring to length of stay. Yet I would ask you to consider the impact on families. For example, the longer their baby is in the neonatal intensive care unit, the longer we have kept a family separated. And the impact on staffing. Think about what it means to have just 1, 2, 3 more patients in your unit. And can you get the extra staffing when you need it? What about the impact on available beds? Is that baby that has an unintended greater length of stay holding a bed that's needed for the next cardiac baby? Evidence-based practice is the process of doing the right thing at the right time and is used to develop standards of care, which are baseline descriptions of quality, to develop clinical guidelines, those broad-based recommendations, to develop critical pathways, the identified key activities that must occur in a predictable order, and to develop protocols, detailed procedures on how to proceed with evaluation or treatment. It is widely acknowledged there are 5 steps of evidence-based practice. 1. Ask the burning question. Be the inquiring mind. 2. Search for and collect current best evidence. 3. Critically appraise the evidence. 4. Integrate all evidence with clinical expertise and patient preference to make practice change. 5. Evaluate the practice change. I would actually add a 6th step here. Disseminate. Share the knowledge. Don't keep it to yourself. It's the right thing to do for our patients and for each other. I realize there may be barriers to implementing evidence-based practice. For example, are there organizational constraints where you work? A lack of support or a lack of resources, even a lack of time? Are you willing to be accountable for your practice? It can be difficult, individually and collectively, but we must be willing to step up and say something. Or is there peer pressure to continue old practices? Those nurses who express, "We've always done it this way," or "It's worked all these years just fine." Has it really, or is there a better way? Change is hard. It may force some to step out of their comfort zone, may make an expert feel like a novice. That's hard to overcome. Maybe colleagues are simply unaware of new practices. How easy is it to access the information? Are there unit champions sharing new information? Are you the champion who is willing to share? It is our responsibility to use new knowledge to improve our practice and our outcomes. Do you have a journal club to seek and examine evidence? Why not start one? Setting up a journal club is a great way to get together and share ideas. Welcome all levels of experience and hold yourself accountable to reading the articles. Yes, nurses can and do research. In order to have evidence-based practice, we need evidence. Nurses are able to use their knowledge and hands-on experience to theorize, hypothesize, conduct studies, and collect evidence. The goal of nursing research is to achieve better care and improve outcomes for patients and families. The term nursing research can be scary, but I challenge each of you to ask why. Go answer the question and share your findings.